Autism Spectrum Disorders, an overview. This tutorial will provide you with basic information concerning autism spectrum disorders. This presentation was developed by the Florida Centers for Autism and Related Disabilities, Florida's first choice for autism support. Each of the 7 CARD centers across the state of Florida expand the capacities of individuals diagnosed with autism spectrum disorders, as well as their families and caregivers, professional service providers, and the communities in which they live. To learn more about the CARD center serving your area of the state, take a look at our websites or call 1-800-9-AUTISM. The objectives of this tutorial are to define autism spectrum disorders, to provide current information about the history, cause, and prevalence of autism spectrum disorders, to identify social, behavioral, and communication characteristics of autism spectrum disorders, to explain the road to diagnosis, and to provide information and address concerns about treatment options. Autism spectrum disorders, which we will refer to throughout this presentation as ASD, are a group of related disorders that share some core characteristics. There are still many things we don't know about autism spectrum disorders, so we will begin by talking about the things that we do know. So as a starting point, this is what we do know about autism spectrum disorders. The brain is a very complex organ which we could compare to the conductor of an orchestra. The musicians play their instruments based on the conductor's directions. One wrong instruction and the music doesn't flow well, or it sounds out of tune. A person who has autism spectrum disorder may show signs that the brain did not develop in a typical manner. Therefore, their brains may not conduct information in a way that processes it easily or in an integrated manner. Nobody knows exactly what causes autism spectrum disorder. Some think it may be the genetic makeup that runs in families, or it could be things that we get from our environment, like toxins or pollutants. There may be more than one cause, or a combination of causes. We just don't know. We do know that research in this area is continuing and many possible causes are being investigated. Because the cause of autism spectrum disorder has not been identified, there is currently no cure for it. It's popular for charities to ask that you help to cure autism. The term cure implies that autism spectrum disorder is a disease, which it is not. Unfortunately, there are no medicines or treatments that make autism spectrum disorders go away. There are medicines and treatments that help manage some of the associated characteristics of autism, but these do not target autism as a whole. Parents need to be cautious of remedies that guarantee a cure for their child. Families should carefully research any type of therapy, medication, or remedy that is advertised as a cure-all. Training and support to evaluate treatment claims is available through your CARD center. While autism spectrum disorder is not a disease and cannot be cured, there is much that can be done to help people with autism spectrum disorders grow and develop skills to lead fulfilling lives in their communities. We will discuss some of these approaches later in this tutorial. Autism spectrum disorder can affect anyone, whether they are rich or poor, educated or uneducated. It affects all races and nationalities and is found in all countries around the world. One thing that seems to be consistent is that autism spectrum disorders are more likely to occur in males. It could be related to the chromosomal structures of males, but this is still just a theory and not a fact. In a recent journal article, it was suggested that an autism risk gene called CACNA1G may prove a genetic cause for autism spectrum disorders. Again, much research will go into these findings to prove their validity. The only sure fact here is that males are 4 times more likely to have autism spectrum disorders than females. Some people with autism spectrum disorders may develop seizures. Usually seizures occur with the onset of puberty. Medications often can help with this. Autism spectrum disorders may not be the only disability present for some people. Sometimes other conditions such as attention deficit hyperactivity disorder or ADHD, learning disabilities, or other mental health issues are also present. There are many types of IQ tests that can measure a person's cognitive abilities. The results of these tests can be very misleading for people with autism spectrum disorders because of language and communication difficulties and the potential trouble of demonstrating skills in stressful or unfamiliar testing situations. Because of these factors, responses on an IQ test may not accurately reflect true intelligence. Autism spectrum disorders are not a one-size-fits-all condition. Characteristics can range from mild to severe. One person might be a NASA engineer, while another may need assistance with simple activities of daily life. The manner in which people with autism spectrum disorders progress over time is a unique and individual process. Someone with autism spectrum disorders may want to make friends just like you do. It's a misconception that people with ASD always want to stay in their own little world. What we might see can be misleading. A child retreating to the corner of the room to play appears to not want others around, but may be overwhelmed by the size of the group or not know how to join the fun. People with autism spectrum disorders have a hard time communicating and recognizing emotions and gestures. They may see another child playing and want to play too, but may not understand how to do that. From their point of view, it might just be easier and more predictable for them to play by themselves. Another child might approach a playmate and hit them for what appears to be no good reason. Often the hitting may not be out of meanness, but could be a way of getting the other child's attention. These inappropriate forms of communication cause further social isolation. We can all go to the doctor for medical tests that indicate if something like diabetes or hepatitis or other health-related conditions exist. We can have the doctor check our heartbeat or take x-rays to determine things such as heart disease or a broken leg. But there is no such simple medical test for autism. The best way to determine if someone has autism spectrum disorder is through observation by a trained diagnostician or a medical professional, and by collecting information on their social history. There's a manual we will talk about later that shows the exact criteria for determining diagnosis. As we've stated previously, there is currently no proven cure for autism spectrum disorders. Most likely ASD will be with the person all their life. Therefore, the sooner treatment and intervention is begun, the better the outcomes will be. By identifying autism spectrum disorders early, we can start putting strategies and therapies together to build supports. For example, if a child with autism spectrum disorder has a hard time communicating with others, supplying that child with the tools for communicating at an early age will greatly improve his or her chances of making friends and accessing a broader range of new opportunities to build friendships. Does this mean individuals with autism spectrum disorders can't have their own hopes and dreams? Of course not. With intensive intervention and educational supports, people with ASD can achieve amazing outcomes and lead productive lives, including family relationships and friends, meaningful employment, and active community participation. So what does the term autism spectrum disorders mean? Under the broad category of ASD, there are several different separate conditions. Many find it helpful to think of the term autism spectrum disorders as a big umbrella that covers the other disorders it includes, such as Rett's disorder, childhood disintegrative disorder, autistic disorder, pervasive developmental disorder not otherwise specified, and Asperger's disorder. Autism spectrum disorder is identified through the behaviors of the individual. Because there isn't a blood test or an IQ test that will by itself provide a certain diagnosis of autism spectrum disorders, professionals involved in the diagnostic process refer to the Diagnostic and Statistical Manual 4th edition, otherwise referred to as the DSM-IV. This manual describes the behavioral features of autism spectrum disorder as the presence of markedly abnormal or impaired development in social interaction and communication, and a markedly restricted repertoire of activities and interests. These three categories are then listed with specific behaviors that can be thought of as indicators of autism spectrum disorder. Clear evidence of at least two behavioral indicators of differences in social interaction and at least one indicator of differences in communication and restricted interests must be identified in order to diagnose autism. Clear evidence of at least two behavioral indicators of differences in social interaction and at least one indicator of differences in communication and restricted interests must be identified in order to diagnose autism. Different combinations are needed for other diagnoses under the umbrella of autism spectrum disorders. Many times people diagnosed with other developmental disabilities or psychiatric conditions may exhibit behaviors similar to these. However, it's the combination of behaviors from each of the three categories that defines autism spectrum disorders. There are 2,027 combinations of autism characteristics that would lead to a diagnosis of autism spectrum disorders. That gives you an idea of the variety and range of the spectrum. Now let's look more closely at the behavioral indicators in each category. Let's start with autistic disorder, the subtype most commonly called autism. At least two of the DSM-IV indicators of social interaction impairments must be obvious. These indicators include a marked impairment in the use of multiple nonverbal behaviors, such as eye-to-eye gaze, facial expression, body postures, and gestures, to regulate social interaction. These indicators mean that a person with an autism spectrum disorder may have difficulty using and interpreting things like body language or facial expressions while interacting with another person. Failure to develop peer relationships appropriate to developmental level. As children grow, their ability to play and interact with other children also develops. However, a child with autism spectrum disorder may not demonstrate interest in the activities of other children or form friendships with them that are appropriate for their own age. A lack of spontaneous seeking to share enjoyment, interests, or achievements with other people. The ability to share an activity or a point of interest with another person is one that begins to develop in infancy. This ability to share joint attention is the foundation for many other social and communication skills. It is a primary indicator of an autism spectrum disorder. Lack of social or emotional reciprocity. This refers to the back and forth turn-taking that is a natural part of social interaction, in which both individuals understand that one partner does or says something, and the other one then responds. There must also be evidence of impaired communication abilities, such as delay in or total lack of development of spoken language not accompanied by an attempt to compensate through alternative modes of communication such as gestures or mime. This means that language and communication abilities do not begin to develop when they should, or they do so either very slowly or in an unusual way. Additionally, the individual does not appear to attempt to communicate nonverbally. In individuals with adequate speech, marked impairment in the ability to initiate or sustain conversation with others. These indicators reflect the difficulty many people with autism spectrum disorders experience participating in conversations with other people, both in starting conversations and following its give and take. Stereotyped or repetitive use of language or idiosyncratic language. Many individuals with autism spectrum disorders will have unusual patterns of speech or voice quality when they do speak. Some confuse pronouns, such as mixing I with you or us. Others may repeat words, phrases, or bits of dialogue they may have heard. Some individuals with autism interpret language very literally and may not be able to understand the meanings of idioms like feeling under the weather or seeing red. A lack of varied, spontaneous make-believe play or social imitative play appropriate to developmental level. Both verbal and nonverbal communication skills are critical to the development of play skills in young children. For children with ASD, language and communication skills that are a part of play abilities do not emerge in the same manner as they do for typically developing children. Their play may be repetitive or rely on following an exact script rather than being creative and flexible. The third category of behavioral characteristics is a restricted range of interests and activities. To support a diagnosis of autism spectrum disorder, there must be evidence of at least one of these indicators. They include encompassing preoccupation with one or more stereotyped or restricted patterns of interest that is abnormal either in intensity or focus. These indicators reflect any interests or abilities an individual may have that are unusual because of their intensity or narrow focus. Examples of this indicator might be an unusually keen ability to recall dates, numbers, or statistics, a fascination with bus routes or maps, or the extent of information known about a specific topic. Apparently inflexible adherence to specific non-functional routines or rituals. Many individuals with autism spectrum disorder become very attached to routines or rituals they establish that may not appear to have an obvious purpose. For instance, a young child with autism may insist on ritualistically lining up cars in a particular pattern rather than engaging with them in more imaginative play. Others may insist that objects in a room remain arranged in a very specific manner, or that a door be consistently ajar at a specific angle. Stereotyped and repetitive motor manners such as hand or finger flapping or twisting, or complex whole body movements. Persistent preoccupation with parts of objects. This could include activities such as persistently flicking light switches on and off, or watching the movement of a spinning fan, or waving the fringe of a favorite blanket. To receive a diagnosis of autistic disorder, there would need to be 6 or more behaviors demonstrating these categories, with at least 2 from the social interaction category. The second subtype of autism spectrum disorder is Rett's disorder, named after Dr. Andreas Rett, who discovered it. Rett's disorder only occurs in females, and it is characterized by some physical changes. It is caused by a defect on a gene that controls other genes that encourage typical development. Changes in development are seen as early as 5 months, when the child's head may stop growing at the same rate as the rest of her body. Early on, girls with Rett's disorder show a lot of behaviors that are similar to children with autistic disorder. Development may reverse between the ages of 6 months and 4 years, with skills being lost in communication and speech, social interaction, and even toileting and walking. There are problems in gait and trunk movements associated with Rett's disorder. Other physical changes also occur, such as a decrease in typical hand movements and an increase in unusual hand movements that mimic hand wringing and hand washing. Rett's disorder is much more uncommon than autistic disorder. Childhood Disintegrative Disorder, or CDD, is the rarest autism spectrum disorder subtype. Characteristics of this disorder are not seen until after the age of 2. They look similar to autism in some ways, but the condition is marked by a decrease in motor and physical skills. After a period of what appears to be typical development, a deterioration in skill areas such as bladder control, language, and cognition begins to emerge. Other autism spectrum disorders, psychiatric and medical conditions such as tubular sclerosis or leukodystrophy that may also result in disintegration of skills must be ruled out. Asperger disorder is under the umbrella of autism spectrum disorders as well. People with Asperger's are characterized by an average or above average IQ, and they can communicate verbally, sometimes having very advanced vocabularies. However, they can be very concrete in their thinking. They may also be highly interested in a specific, sometimes narrow topic, or have repetitive behaviors. Asperger disorder is under the umbrella of autism spectrum disorders as well. People with Asperger's are characterized by an average or above average IQ, and they can communicate verbally, sometimes having very advanced vocabularies. However, they can be very concrete in their thinking. They may also be highly interested in a specific, sometimes narrow topic, or have repetitive behaviors. For example, you may meet a person with Asperger's, and they may speak at length about a movie they saw over the weekend, giving you every detail of it. However, if you try to interject your comments about a different movie you liked, or change the subject, the person with Asperger's may continue talking about their movie without picking up on your attempts to change the subject. If you look perplexed or upset about this, they may not understand how to read your body language, your facial expressions, or even your tone of voice. Sometimes the characteristics of Asperger's can look like other disorders such as schizophrenia, and unfortunately can be misdiagnosed. The characteristics of Asperger disorder may not seem obvious at first glance. However, on closer observation or after getting to know the individual, you will see their differences come from a difficulty in understanding social interactions. The characteristics of Asperger's in young children may not be spotted right away, and so it's not uncommon that the diagnosis comes later, many times not until the child begins experiencing difficulty in school. They may seem a bit uncoordinated, disorganized, and are often referred to as little professors. There have been cases of people not being diagnosed until adulthood. You may know someone who has these traits but has not been diagnosed. People with Asperger's disorder can also take things very literally and have issues with idioms. They may not understand the figurative meaning of phrases like feeling blue or jumping the gun, and may therefore not know how to respond or may respond very literally when those phrases are used. This can easily lead to misunderstandings or being seen by another person as rude, insensitive, or silly. It can also be especially difficult for someone with Asperger's disorder to see the flexibility in an issue. If the classroom rule says, "Stay in your seat during testing," and a classmate raises their hand to ask permission to get a drink of water, a student with Asperger's may get upset, thinking that the rule was broken. They're not incorrect, but some assumptions were not clear to the student with Asperger's, that being that you can raise your hand to get permission from the teacher to break the rule. We teach math, science, and reading to all students. It would also be beneficial to teach social skills and flexible thinking to students with Asperger disorder. This brings us to pervasive developmental disorder not otherwise specified, which is often referred to as PDD-NOS. PDD-NOS is the diagnosis given if the individual has behaviors that fall into the three categories for autism spectrum disorder, but either does not show the correct pattern for autistic disorder or does not show enough symptoms for another ASD subcategory, or is very young and cannot be assessed on all of the behaviors needed to precisely diagnose the subtype. Sometimes children with PDD-NOS actually show more symptoms than some children who meet the criteria for autistic disorder, but they do not show as many behavioral indicators in the category of social interaction. Some doctors tend to give the diagnosis to younger children because they may not have fully exhibited all the traits of autism until they get a little older. You will often see this diagnosis for the very young, and then after being reevaluated when they are a bit older, the diagnosis of autism may then be given. It's not uncommon for individuals with autism spectrum disorders to demonstrate other behavioral, sensory, or information processing differences. These differences include issues with sensory processing. Often people with ASD experience difficulty processing the information that comes to them through their sense of hearing, vision, smell, taste, or touch. Occasionally they respond differently than most people do to sources of sensory input. They may have a very hard time tolerating light, scratchy textures brushing on the surface of their skin, such as a tag at the collar of a shirt. They may overreact to some noises and not seem to respond to others. Some people may appear to have a very high threshold for pain, as they may not react in the usual way to injuries or pain from illnesses. Motor skills. It's not unusual to find differences in motor skills. Fine motor skills include the smaller movements made with fingers to complete the ordinary activities of daily living, such as writing with a pen or a pencil, buttoning a shirt, or putting coins in a vending machine. Gross motor skills are all those larger coordinated movements that involve the use of a person's arms and legs. This might include simple movements such as walking or running, or more complex movements such as carrying a tray or throwing a ball. The differences in motor skills that people with autism spectrum disorders experience are more obvious in comparison to people without disabilities of the same age. Attention. Some individuals with autism spectrum disorders exhibit differences in their ability to focus and to pay attention to tasks. This could be either a short attention span or a very intense ability to concentrate on a single activity to the exclusion of all others. Organization. Successfully managing one's time and organizing one's materials, possessions, or personal space can often be a challenge for people with autism spectrum disorders. Motivation. Motivation may be an issue for some individuals with ASD. Some may appear to be disinterested in interacting with other people and activities happening around them. Others may be motivated by the sensory feedback they receive from watching lights or spinning fans, or from waving their fingers or walking on their toes. Learning. Given the range of communication and information processing issues often experienced by people with ASD, it's not surprising to know that they also often experience significant learning differences. These differences sometimes express themselves as difficulty learning new skills or demonstrating the skills that they've learned in new situations. They may also have difficulty maintaining the new skills that they've learned. Coexisting conditions. Occasionally, people with ASD will demonstrate behavior symptoms or characteristics of other sorts of diagnosable conditions, including mental health conditions such as anxiety or depression, or medical conditions such as seizure disorders and extreme allergic reactions. Occasionally, individuals with autism spectrum disorders also demonstrate other behaviors, patterns, or characteristics, including atypical mood or affect. This means that the facial expressions, body language, and tone of voice the individual will demonstrate may not match or seem appropriate to the circumstances of the environment. This might be expressed as a noticeable lack of emotional reaction at occasions in which most people would typically openly express their feelings through smiles, laughter, or crying. On other occasions, people with autism spectrum disorders may laugh or seem extremely agitated at times when nothing seems to be particularly funny or exciting for most people. Eating or sleeping difficulties. Often, individuals with ASD also have irregular eating and sleeping difficulties. Some may only want to eat a certain type of food or may have a reluctance to eat food with particular textures, flavors, or odors. Others may have irregular sleep patterns. As with most people, individuals with ASD can experience periods of depression through their lives. This condition can be brought on by any number of stressors and may be expressed as a loss of energy or interest or appetite, irregular sleeping habits, or changes in behavior. Challenging behaviors are particularly an issue for individuals with significant expressive and receptive language deficits. Hyperlexia, or precocious word decoding abilities, will occasionally be apparent in young children with ASD. These children may demonstrate an extreme interest in letters and word spelling, but often don't demonstrate word comprehension abilities at a similar level. Selective listening. It's not uncommon for some people with ASD to demonstrate differences in their auditory processing and comprehension abilities. This obviously will have an impact on their language abilities. In addition to this, some individuals may be extremely sensitive to particular sounds or noises, such as loud, sudden fire alarms or lawnmowers. They may also be very sensitive to lower frequency noises that have a particular meaning associated with them. An example of this sort of sensitivity could be the ability to detect the sound of cellophane being unwrapped from a food package in the kitchen downstairs. Other individuals may not demonstrate a reaction at all to the sounds that most people would find difficult to ignore, such as a baby crying or a blaring television.
So why are we hearing that ASD is on the rise? Currently, we have 1 in 88 people diagnosed with autism in this country. Some theories of the increased numbers include changing the definition of autism in the DSM-IV manual discussed previously. The child who today has been diagnosed with autism may not have been identified 20 years ago. In other words, the criteria has become more broad and is not as specific. By doing this, more children now meet the criteria. It was only in the 80s that autism was even considered as a developmental disability. Before that time, autism was thought to be a psychiatric condition such as schizophrenia. In the 1990s, the criteria was broadened, thus allowing for wider diagnosis of autism. States have done a good job of identifying children who may need special education services and interventions at an early age. In other words, if a parent or a teacher recognizes a child may have a disability, specifically autism, the process for accessing intervention services starts immediately.
So what does the future look like for someone who has autism spectrum disorders? Well, many factors can influence their prospects. Some severe traits, such as low intellectual abilities, may affect the outlook of one's life. However, supports can be created to offset some physical or cognitive limitations that would otherwise be significant barriers. Working hard to acquire new skills and intervening at an early age can affect the outcome of lifelong capabilities. It will be important to recognize that your child will need a solid support system that encompasses an array of interventions, services, and resources throughout his or her lifetime. Having family members be a part of the support system is vital. At times, it may be hard on brothers and sisters, aunts, uncles, or grandparents to be fully involved in the efforts to support a family member who is in need of extensive care. But when all family members participate in and share the support process, the family as a unit will be that much stronger for it. Understanding the road to diagnosis. There are many different reasons to seek a diagnostic evaluation when there's a question of autism spectrum disorder. Here are some of the most common. Early identification. In many cases, the process of identifying the concerns a child presents is the first step families take. Through the process, families begin to build an understanding of the social, communication, and developmental differences of their child. This also allows them to begin to address the immediate and long-term implications that will affect their family. Often, the evaluation process leads those involved to sources of further information, be it additional research and treatment options, to referrals and community contacts. To a certain extent, understanding the nature of a child's disability will provide a starting point for developing appropriate support, be they educational, therapeutic, behavioral, or medical. A diagnosis of autism spectrum disorder quite often has an impact on the entire family. An evaluation that is conducted in a thorough and comprehensive manner will also lead the child's family to resources and support for themselves. And most importantly, a good evaluation specifically identifies the nature of the child's disability and provides a starting point for accessing interventions and supports. In combination, all of these things will then lead to successful, immediate, and long-term outcomes for both the child and their family. Young children who will eventually be diagnosed with autism spectrum disorder often begin to exhibit certain behaviors during infancy. Some of these early behaviors include: the child doesn't offer big smiles or other warm, joyful expressions by 6 months or thereafter. No back and forth sharing of sounds, smiles, or other facial expressions by 9 months or thereafter. The child does not engage in babbling or other vocalizations by 12 months of age. The child does not engage in back and forth gestures such as pointing, showing, reaching, or waving by 12 months of age. The child is not using single words such as up, juice, or doggy by 16 months of age. The child is not using two-word meaningful phrases such as go bye-bye or want milk without imitating or repeating by 24 months of age. And lastly, if the child appears to lose speech, babbling, or social skills at any age. Why is early diagnosis so important? Obtaining a diagnosis at any age is always the first step to successful intervention. However, this is even more important for young children, as many early intervention services end or are phased out at 3 years of age. To maximize the full benefit of these often critical early services, it makes sense to begin them as soon and as quickly as possible. Another reason why an early diagnosis is so important is it allows intervention to begin when cognitive, language, and social abilities are first developing. The period from birth through the first 3 years of life is a time when a child's brain and neurological system are growing and changing at an incredible rate. Early intervention is critical for children whose development in these areas might not be typical. Whether a child receives a diagnosis during their first year or towards the end of their third, it's the first step in determining eligibility for early intervention or special education services through the public school system. Furthermore, funding for other important services such as speech, occupational, physical, or behavioral therapies may be determined on the basis of a completed diagnostic evaluation. Determining whether or not the diagnosis of autism spectrum disorder is the most appropriate one is often a complex process. Unlike many other conditions in which a precise diagnosis can be determined, autism spectrum disorders are identified through gathering information or evidence of a cluster of observed behavioral patterns. There must be clear evidence of the indicators from each of the previously described categories in order to warrant a diagnosis of an autism spectrum disorder. Because of this, information must be gathered in a number of different ways and from a range of sources in order to complete a thorough diagnostic evaluation. Here are some of the sources of information that are often gathered and reviewed during a diagnostic evaluation. Medical assessments often start the process. These would include significant prenatal, birth, and early developmental information, as well as specific medical and family histories. Additionally, laboratory tests and other neurological evaluations can be used to rule out the presence of other conditions that could result in similar patterns of behavior or development. Interviews and records review often provide insightful information from parents or caregivers that may not be captured in more clinical or physical evaluations. This sort of information can also describe circumstances around a particular concern and details as to changes over time. An example of this type of interview is the Autism Diagnostic Interview Revised. There are also several behavior and symptom scales available. Here are the names of those that are most often used. The Autism Diagnostic Observation Schedule, or the ADOS. The Gilliam Autism Rating Scale, or GARS. The Autism Research Institute, ARI, Form E2 Diagnostic Checklist. The Childhood Autism Rating Scale, or the CARS. The Asperger Syndrome Diagnostic Scale, or ASDS, or the Gilliam Asperger Disorder Scale, or the GADS. Now let's spend a few minutes considering all the characteristics of effective interventions. When considering all the possible treatment options that could be available, the most important thing to keep in mind is that all individuals with autism spectrum disorder are unique people with different behavioral and learning profiles. What works for one person may not work at all for another. Any type of treatment method should be well thought out to match the needs of the individual. This being said, there are a few aspects of any treatment that can be thought of as reflections of its effectiveness. In general, effective treatments are typically those that are early and intensive, multidisciplinary and well-coordinated, multidimensional, targeting the pervasive nature of the disability, individualized for the person and the contexts of their life. Quite often, young children who receive a diagnosis of autism spectrum disorder receive intervention from a wide range of treatment fields. It's important to understand what each type of intervention field is so that good decisions can be made about what they all can offer a child. Medical interventions work within the body of the child. These could range from prescribed medications or medical procedures to special diets and vitamin regimens. Whatever the special treatment may be, it should be closely supervised by a qualified medical practitioner. Behavioral interventions are based on a deep understanding of the child's behavior as well as the situation it happens in and the things that happen after it occurs. The goal of behavioral intervention supports is to increase the occurrence of successful adaptive behaviors and to decrease problematic ones. Play-based interventions target early social, developmental, and communication abilities through play activities that are guided by a therapist or a parent. Communication interventions seek to expand a child's receptive and expressive communication abilities. Sensory-based interventions address the differences in sensory processing that are often experienced by young children with autism spectrum disorders. This type of treatment is most commonly provided by an occupational or physical therapist. Educational interventions take the perspective that many of the challenges a child with autism spectrum disorder faces are a reflection of underlying skill deficits. The goal then becomes to identify those deficit areas and to teach more successful adaptive skills. Although this list is certainly not comprehensive, here are a few of the different approaches that fall into one category or another of the intervention umbrella. Regardless of which field an intervention approach is grounded in, effective interventions will always have a significant impact on functional spontaneous communication, social interaction abilities and opportunities, cognitive development and adaptive skills, positive behavior support focusing on prevention, and improving quality of life for the individual now and in the future. Instruction for students with autism often varies from one school or district to another. However, effective school programs, that is, those in which student learning outcomes are consistently achieved and well documented, reflect the same foundations. In 2001, the National Research Foundation acknowledged these foundations as the following. Intensity matters. Quality education and intervention programs actively engage students in direct instruction for at least 25 hours per week or more. Early is better. Intervention by 3.5 years of age is more effective than after 5 years. Family participation is essential. Family involvement plays a critical role in effective educational programming for students with autism. Educational goals should be individualized. Goals and supports need to target individual behaviors as well as social, communication, and academic priorities. Educational goals must also be monitored regularly. Progress towards educational goals must be evaluated in an appropriate and ongoing manner in order to ensure effective instruction. Instruction should be based on research evidence. Teaching strategies and techniques for all students with autism spectrum disorder, regardless of their ability levels and support needs, should be grounded on a solid body of educational research. Special considerations should be recognized when dealing with autism spectrum disorder. There are many support strategies for ASD. However, as we've mentioned before, not all of them are effective for every person or in every situation. Parents may be overwhelmed with the information they receive from the internet, from reading resources, and from other parents' experiences. Because of this, families should be aware of strategies said to be appropriate for all. Again, it's not a one-size-fits-all condition. Unfortunately, companies may prosper off of a family's desperation to find a particular technique or intervention that works for their child. They may sell a product or a method of treatment that is not appropriate for any given individual with ASD. Families should research any strategy or method that is available and confirm that the results are backed by valid data. Even if it is a proven method, it still may not be suitable for a particular individual's situation. Families should know there are several options available. Again, the family should do their homework and select the option that is best for their child. Be a cautious consumer and educate yourselves to the pros and cons of any approach. Treatment should be based upon assessment data. Autism has become a targeted market, and people may be willing to use untested or experimental products and procedures. While many intervention approaches can have a significant positive impact on the lives of an individual with ASD, at this time there is no known single intervention that can be legitimately seen as a cure for autism. Part of making a sound decision about the use of a particular intervention is to learn more about the intervention itself. Here are some questions to ask to help you gather more information to base a decision on. What are the expected results? Learning more about how an intervention works and the impact it has had on other individuals can help you gauge what you might be able to expect for your own child. What are the possible side effects or potential risks of the intervention? Many medications and therapies that impact the physical state of the individual can have side effects that might be undesirable and even dangerous. Be sure to ask questions regarding what those side effects might be and how to identify them if they should begin to occur. Has this treatment been confirmed by scientific research? There must be a substantial body of research-based evidence backing the use of any intervention promoted for the treatment of autism spectrum disorders in order for it to be considered a valid practice. In cases of medication therapies, have these been approved by the FDA? Try to learn as much as you can about the evidence that indicates the effectiveness of the particular intervention. Do you feel it is substantial enough to warrant the use of the intervention with your child? Is the treatment promoted as a cure? You may find there is a great deal of testimonial support given to different treatments that come into vogue, but their impact has not been substantiated by solid research-based evidence. Therefore, approach any treatment that is promoted as a cure with caution. Other factors that should be considered when determining the appropriateness of a particular intervention approach are more circumstantial to the individual or the family. So it's always very important to consider the following questions. How much time does the treatment take to have an effect? Will the effects of the treatment be immediately apparent, or will they gradually build over a period of time? How will the effects be sustained over time? How much does it cost? Does the intervention involve the purchase of medications, dietary supplements, or equipment of any sort? Is significant travel or time involved? Will you need to pay for services rendered by a professional on an ongoing basis? Would either of these types of expenses be covered by insurance? Ultimately, the question will come down to the financial impact the treatment will have on a family's budget and whether or not the costs involved can be met. How are the results of the treatment evaluated? Many treatments require close monitoring, either through data collection or the ongoing gathering of evidence. This allows the effectiveness of the intervention to be measured over time, with further adjustments made to the treatment if they are indicated. Does this require the family to gather data or to keep information on a regular basis? Who will be responsible for reviewing the information and making decisions about the treatment's effectiveness? Does the treatment match the needs of the child and the family? And is the family able to carry out the treatment in the home or community setting? Some methods may be more difficult to practice in a non-sterile environment, such as the home or the community. They may require specialized expertise or professional supervision in order to be successfully implemented. Making decisions about intervention options should be a thoughtful and deliberate process that is based on a thorough understanding of the intervention itself and a reflection of its potential impact on your child and family. If you still have questions or feel you would like further information or support, please feel free to contact the Card Center in your area.